of all, thank the organizers of this conference for giving me the opportunity of this dialogue this morning. I'm actually delighted to have this discussion with you. What I'm planning to do now is to look at research ethics has the need for a system to be in place. Speakers have done a presentation already on important existing international guidance documents such as the Declaration of Helsinki and SIOMS. What we have been trying to do at WHO is to work with these important documents in collaboration with our member states in establishing systems for the ethics review and the ethical conduct of research. A system looking at the different stakeholders, basically institutions such as research ethics committees, also the need for the normative framework, and this is where it's particularly important to refer to existing international guidance and harmonize what is in place at country level, and also to contribute to this dialogue at international level and try to build consensus where it's needed. Dr. Kloiber alluded to the long discussion around the use of placebo in clinical trials. Well, this is also the kind of contribution WHO tries to make in order to build consensus. A system of ethics review of research involving human beings or human participants should be actually person-centered, and that means that other stakeholders have this common objective of protecting potential participants to the research. I have to say, and actually Dr. Valentin mentioned this in his presentation, beyond this term of participants, we have also the community, the society, which can benefit and should benefit from the result of the research. So the whole system should be centered on participants and their community. Particularly important actor is the Research Ethics Committee, but also we have national regulatory authorities involved in this system to ensure that regulations are in place at national level and also harmonized with international guidance. Sponsors and investigators have very specific responsibility in the ethical conduct of research. We also have to mention journals, and I will develop later on the issue of publication of results. Well, we know how is it important to have access to result of research, particularly to negative results, which are often missing. And this is the reason why some trials are repeated, exposing people to unnecessary risk. Another important tool for the transparency of research activity and public access to information related to research are the clinical trial registries, and WHO has taken also an initiative on this. I will come back to this later on. First of all, in terms of strengthening institutions, strengthening research ethics committees. Based on existing international guidance, particularly the Declaration of Helsinki and the SIOMS guidelines, WHO has published 2 years ago a document which is summarizing operational standards for research ethics committees. And we are now developing a tool which will be a set of indicators so countries will be able to ensure that research ethics committees at national level are following these common standards. So what are they? I will not go into the detail of all these standards, but just to illustrate that the procedure to review protocols, research protocols, are really person-centered. Well, first of all, clear responsibilities have to be identified, in particularly in who is responsible to ensure this system is actually functioning, protecting people who accept to participate to clinical trials, but also improving the ethics of research in general, in particular, taking into account access to the benefit of the research. So, as I mentioned, there is a specific responsibilities of national regulatory authorities in this. The composition of research ethics committees. Well, this is where, for example, there is an important role of potential participant to research. As you know, all research ethics committees are supposed to have a minimum of one member, which is defined in most of the international guidance document as a lay person. It's always difficult to really describe what is a lay person. We are probably all lay person for many issues, but the most important is to have in this committee people who are not directly involved in research activities, people who are not health professionals, and who have more experience of what is a patient, what is the view of a participant in research. Sometimes they are representative of patient organizations, but they can be they can have very different profile. What is important is to take into account from the beginning that this approach has to be included in the ethical review, and this is not only in analysis from a scientific, professional, or ethicist, but it's also the view of the people. An important aspect, and this is usually what we discuss when we work with research ethics committees in the field, in countries, is the resources, financial and human resources, and linked to this, the training of the members. It is extremely difficult to evaluate a research protocol from a scientific point of view. As Dr. Kloiber mentioned, it's the first aspect you should look at. The scientific validity is the first ethical concern. But it's also very difficult to have members of ethics committee trained to do this work in an adequate way, in particular to be independent from all kind of undue influence. And when I say undue influence, I have to include sometimes conflict of interest. It is also very important to have in place institutions very transparent on their modalities of work and accountable to whom? Well, first of all, accountable to who will be the participant of the research. And beyond this, to the community where the research is taking place. So in these standards, we have one chapter on ethics review, which is actually summarizing what is already established in other documents, such as the Declaration of Helsinki and Sion's guidelines. We also look at the way decisions should be taken in these committees in order to ensure the pluralism and the multidisciplinary approach, in order to ensure that actually this review is centered on the protection of a research participant. I have to say that with time, I think there is a new trend. This review has been really focused on individuals, individual rights, so risk and benefit for potential participants, confidentiality of data from participant, informed consent process obviously has the expression of the autonomy of participant. Now, in addition to this, I think there is more and more concern about what is actually happening when the research is over, what is happening in the community, in the society where this research has taken place. And the concept of equitable access to the benefit of research is taking more and more relevance, including in the previous review of research protocols. The WHO standards also look at clear policies established by research ethics committees. So this has to be the basis of the system and define what are the specific responsibilities of researchers and sponsors in their interaction with these ethics committees in charge of the previous analysis, ethical analysis of the project. Well, sometimes we have seen that good guidance document and strong institutions are not always in place in every country where research is needed. For example, we have been asked last year to organize a joint review for a research project which is now ongoing in Central Africa. We had several candidates as host countries for this project on African trypanosomiasis, which is actually a priority for these countries. One of them was South Sudan, Chad, and Congo. Well, actually, I'm traveling to Congo end of the week because we know that in these countries we don't have all the components of the system. Sometimes ethics committees are not very well established or don't exist at all, and very often there is no national regulation. So to help these countries and facilitate the ethics review of important research projects for these countries, we can also provide some kind of technical support. And what we did, for example, last year, is to organize a meeting with a number of African experts from the possible host countries, but also from other African countries, and members of, in that case, European Ethics Committee. And this process done before the local ethics review and obviously local approval by an ethics committee is also a way to strengthen capacity at local level. Sometimes we have been asked also to focus on very specific questions. And this year we had a request to organize an expert meeting to look at the use of placebo in vaccine trials and to help people to understand what is established in the Declaration of Helsinki or SIOM's guidelines in specific cases of vaccine trials. So you see how we try to complement what is in place in order to strengthen this ethics review systems and to ensure that participants are protected, but also the research is focused also on public health needs. It is also important to look at the different existing documents and try to harmonize them. So I know this is ongoing between the Declaration of Helsinki and SIOMS, particularly because both are under review currently. Other documents are important. For example, you have regional documents with a legally binding power. It's the case of EU directives, and as some of you may know, there is a proposal now to have a regulation for EU member states, which is producing some concern. So I also invite you to look at this proposal. I just want to conclude my presentation with a project which is illustrating the way to improve transparency in research activities and to include patients in this dialogue. In 2006, the World Health Assembly decided to adopt a resolution which is now concreted in a project called the International Clinical Trial Registry Platform. This is a project, a platform collecting information from 15 registries. Some of them are collecting a lot of information. This is the case, for example, of clinicaltrial.gov in the US or EU CTR in the European Union. Others are smaller in terms of the quantity of data. You have here the list of the 15 data providers. But the purpose of this platform is actually to improve access to important information from patients or potential participants to research. We have 20 items describing each of these clinical trials, and we are now discussing how we can have a more friendly presentation of this information for patients or for the public. How we can include more information, particularly about ethical approval and also about study result. Two of these data providers, EU CTR and clinicaltrial.gov, are actually collecting information about result, and we are in discussion with this network in order to see if this is feasible. Well, obviously, the first problem is to define what is a result, and particularly when you give public access to this kind of information. I don't know if I have one more minute. One. So in 1 minute, I just want to show you a concrete example of WHO work in the field. This is the Pan-African Clinical Trial Alliance, where we have representatives of research ethics committees, national regulatory authorities focusing on the way to establish this kind of systems centered in people participating to the research or benefiting from the research. This network includes 20 countries. So I won't have time to present what we can do on consensus building, but perhaps we can discuss afterwards. And in conclusion, I would like to insist on the fact that the approach we have to take now for the ethics review of research is really a holistic approach. And we have to put in place systems in which a number of stakeholders have to share responsibilities, one of them being obviously the potential participant and persons who can benefit from the research.